Let's bring our evaluator up here, Barbara Decker.
Thank you, Jim. It's my pleasure to introduce Mr. James Smith, who has been an employee with the IRS for 18 years, and he's currently employed as a customer service representative. He also is a sole proprietor for 15 years as a financial service representative. So he enjoys being an empty nester. That means his children are not at home. He and his wife are together. Thankfully, he is. So she and he are not together constantly. He is a second-year Toastmaster with Competent Toastmaster designation goal within the reach for this year, which will help us achieve our goals as a club. James' speech today is Healthcare Crisis Real? It's speech number 7 under Research at Top. Is the Healthcare Crisis Real? James Smith.
Good afternoon, fellow Toastmasters and guests. It's my privilege to be able to share with you this evening information about the healthcare crisis. Is the healthcare crisis real? You bet it is. Everybody wants healthcare, but nobody wants to pay for it. Do you know anybody that wants to pay for healthcare? Absolutely not. The federal government has said, with statistics from Health and Human Services, that there are approximately 40 to 50 million Americans that don't have health care of any type, other than the wrong type, which is to pay too much if you need it. Many people's health care is the emergency room at your local hospital. They pay as you go. There's long lines, and that's causing problems in our healthcare systems. What's causing this problem? Well, there are many things that cause it, but 4 come to mind right away. First is price. We that have healthcare know about what it costs for healthcare. But I'd like to share with you something in my research. In my research in getting the prices. As an agent, I have access, of course, to the prices for major medical. And they may surprise you. Would you believe that a 35-year-old person with a family with Blue Cross and Blue Shield, family meaning 3 or more now, could be 15, 20, but at least 3. This is what it costs with a $1,000 deductible. $837 a month. Now, that's a $1,000 deductible. The higher the deductible, the lower the price. How would you like a $3,500 deductible and the price be $381? This is giving you an example of why people don't have health care. There's another scenario that goes along with price, and that is, even if you could afford it, and money was no option, you may not be able to get it because there's qualifications on getting health care, such as your height and weight, what kind of prescriptions you're taking. You see, if you have group health care, you're shielded from all this because you just sign up at work. And that's what causes many people to have to take a job just for health care. There's no eliminations. Doesn't matter what your health's like. You're automatically approved. That's wonderful. Then on top of that, you get the group rates if your employer so chooses to participate in that. I remember when my first child was born, and I'm still with the same company, Kaiser Permanente. I can't get away with them. I've been with them about 22, 23 years. As long as they've been in business, I've had Kaiser Permanente. When my first child was born, my son, he came out with a funny shaped head, but he's all right. And I remember asking the doctor, is that going to change? Because he had been trying to get out for 2 weeks. And my wife had a C-section. So when he came out, his head was shaped like an egg. So thank God, he's smooth, no problem. The point I want to make is this. Here we had a child. We paid nothing. There was no co-payments, no deductibles back then. And then they gave us a steak dinner on top of that. My second child, she was born, there was no more steak dinners. As a matter of fact, the hospital's no longer in business. Well, what happened? Things changed, the market changes. In fact, it was up here in Chamblee. It was called Chamblee Community Hospital. They're no longer here. But as time changes, now Kaiser Permanente has deductibles. That was their claim to fame. There was no deductibles. Now they have deductibles because deductibles help keep the price down. I mentioned price. I mentioned qualifications because this is what we call an underwriting guide in the business, and it tells you what to look for, and height and weight tables and all that. We're shielded from all that in the group plans. None of that matters. That's why another reason people choose certain jobs. They want jobs that have health care access. Number 3 in the problem area is litigation. Litigation, lawyers ready to sue, ready to sue, ready to sue. That's jacked it up as well. And lastly, the 4th area is cost shifting. Cost shifting means if there's an empty bed, when you come in with a card, you have insurance, your company's going to be charged for that bed. I remember going into an office recently, and I went on a cash basis for this particular situation. I said, he said, we'll give you an opportunity. The doctor said, I'll just charge you the lowest rate, $40. I said, well, how much would it be if you sent this to Kaiser? He said it'd be $200. So you see, it's all kind of games being played, and that's leading to other things. Now, what if you don't have health insurance? You can go to Grady Hospital. My wife works at Grady. I used to work at Grady. She works in the area of Medicaid, where the government's trying to get the money back from the people. They don't tell the truth. They don't tell where their address is. You ask them where they live, and they don't tell you the truth. The reason I brought up Grady is because Grady's been in the newspaper recently for months and months. They finally got a deal to go nonprofit, which is going to help them stay around. And the reason for that is because of price. Grady had a $500 million budget, $50 million deficit in the hole. How do you get out of that? Not easy. Price of health care again. Now, as we know, this is one of the top political topics in the news today. The war, health care, and energy, all those things are important. In my research, if you go to www.cnnpolitics.com, it gives the different candidates' perspective on health care. And allow me to read them real fast. John McCain opposes federally mandated universal coverage, would increase awareness and promote the use of existing children's health insurance. Hillary Clinton mandates individual health insurance for all Americans. She's going to make it mandatory, and it's coming out of your check, too. She wants everybody, you don't have no choice, to have health insurance. Barack Obama will create a national health insurance program for individuals that do not have employer health care, but he still says the rest of you that have it, fine, you can keep it. I said all of that to say this, in conclusion, that I hope you surmised by my talk today that we do in fact have a health care crisis. Our system is fast becoming a system of haves and have-nots. You can help pay for the health care crisis by making good personal decisions in your own health care and becoming involved in the political process, knowing what's going on. It's going to cost you one way or another. Mr. Toastmaster.